Send you in death, you could them see me that's so up on team. Street to no swap on my I suffer for the show my sword thing. Your name money share to someone nice for some of your boy thing or dumb with champagne juice. Energy drink, mama to come and one thing. Savages in my section. Pussy boys don't come close, baby. Bitch me no chase section. As they say, set it up by your daisy. My name is ya up and I stacy. Off white trip, no fugazi. SKK, no fugazi.
Holy fuck! Go just on, I mean, I'm off from here when you have been chasing you up. Songo Mafia, take my slow baby.
Hello, good evening. Welcome to the OT Health Talk. Thank you for all for being here and being here on time. My name is Akos. I'm your resident doctor here who usually takes these sessions. I'll be your host and your guest for today, so please do bear with me. Before we start, as we usually do, just some housekeeping. So thank you all for coming. We'd like to thank our sponsors, Taptap Send, and also OT Media for making this show happen every week, every Wednesday, 8 o'clock. And most importantly, we thank you all the viewers who are here in day in and day out. I can see some familiar faces, but if you're also here for the first time, welcome. The show structure is usually the guest, which would be me today, would give a talk for 30 minutes, which would then be followed by 30 minutes of Q&A session where you can ask not just anything, not just questions pertaining to today's topic, but this is the only show where you get a GP for basically free. So you can ask any medical questions that you have. It doesn't have to be in line with today's topic, but anything that you might want me to shed some light on, I'm more than happy to do that. And if I don't have the answer, because we don't always know everything, I'll get back to you, and I'll make sure to get back to you. So right, that's all the housekeeping for today. I'll go straight into why we are gathered here today. So I know that on the flyer, it obviously says that it's a tribute to Professor John Arday. I'm not going to go into the reason why, that he passed away, but what I do want to highlight today is suicide, because that's what we're here to talk about today. And we're using that to almost sort of remember him and also just pay tribute to him. So the important thing is that we need to learn how we can recognize distress, how we can respond to distress, and how we can talk about suicide without stigma, especially in African communities, okay? So in African Caribbean communities, so this is what we're talking about today. So yes, that's the first thing we're talking about. My objectives for today would be to understand suicide, recognize when somebody is struggling, challenge the stigma, okay, and support ourselves, our family members, our friends, and then reflect on the life and legacy of Professor Jason Arday. Okay, so we'll go straight into it. And just a reminder today that if you don't have to share anything personal tonight, honestly, if the conversation becomes overwhelming, it's okay to step away. There are people who may have family members who have personally experienced suicide or loss in the family. So no need to feel like, if you feel like it's too much for you, you can step away, and you don't have to share anything that you don't feel comfortable sharing. Okay. And yes, we will not discuss in terms of, we won't go into graphics in terms of suicide and methods and things like that. We're not going to talk about that. We're just going to talk about how to prevent it and how to figure out when somebody is struggling. So, as I said, I'll go into the suicide in my next section, but I want us to take a minute to sort of remember Professor Jason Arday. Before the controversy, we need to remember that he was a professor and a sociologist. He was a prominent Black academic. He was a father, a son, a friend, and a colleague. He was someone whose career was inspired by many people, and he became Cambridge's youngest Black professor in 2023. So it is important that when someone dies in these circumstances, we do not reduce his life to the circumstances of his death. So we don't just remember him as, oh, he's that professor who committed suicide. We need to remember that he was a person before the headlines. He had a career, he had relationships, he had achievements, great achievements, and there were people who loved him, people who still love him, and that's what we need to remember about him. So, you know, aside all the news out there, or the media, and, you know, however he's painted, whether he's painted as a saint or as a devil, we need to remember that at the end of the day, he's still a person, okay, or he was a person, and there's a legacy that he's left behind, okay. So, right, what is suicide? The definition of suicide is the intentional act of ending one's own life. Okay, so unlike, the word came to me, euthanasia, which is different. So that's somebody ending somebody's own life. So that it's not murder. It's a bit different from that. But essentially, people would say it's like murder. But suicide is when you take your own life, basically. Okay. So it is rarely a simple thing. Sometimes, and again, in our African communities, you know, the first thing that somebody would say is, "Oh, why did they do that?" Or, "Oh, why, you know, why would you do that?" And it's almost a stigma that comes with it, like, "Oh, don't do, that's silly," or, you know, don't do something like that. But there's a lot of things that can go on in somebody's mind before they decide to take such a drastic decision. It can occur when somebody's experiencing overwhelming psychological pain and feels that they are unable to see a way forward, and all that they think of is that, I just need to end this, and I need to end this now. A lot of the time, before somebody commits suicide, there's already an underlying mental health issues going on in the background, and oftentimes people are already struggling to almost stay above the water. So there's a trigger that causes somebody to just sort of say, "That's it, that's enough, I can't take it anymore," and then they take their own life. It's not a pleasant thing to do, and it's not easy. I find people who take their own lives are actually incredibly brave. It's very difficult to do, and if you, I don't want to use this word lightly, but if you're a sane person and you've ever tried to harm yourself, you would immediately recognize that you're not able to even go through with it, because it's very painful. It's not the most comfortable of things to do, and to actually push yourself beyond that point where you're able to take your own life is in a way, some people can say it's actually a very brave thing to do, but unfortunately, you know, there's stigmas and connotations that come to that, and it's not something that I'm saying the brave thing to do is not something that I advise, or I'm going to advise on this program. So just disclaimer, okay? Right. So we need to move away from the simple explanations of when we hear that somebody's taking their own lives. "Oh, but they had everything going for them," or, "Oh, I wish I were them. I remember they were so successful. Why would you take your life if you're so successful?" Or even things like, "Oh, but they had family. You know, were they not thinking about their kids, their wife, and things like that?" None of these things make somebody immune to suicidal thoughts. Mental stress doesn't look the way that we expect it to look. So, like I said, in a sane person, I'm using that word very lightly, because I'm not saying that if you've got mental health that you're not sane, but I'm saying when you have mental health, we know that you've got a medical diagnosed condition, and we've talked about mental health here previously, so I'm not going to delve into that. If you want to know more, please do ask questions. But if you've got mental health, essentially your mind doesn't work in the same way that a sane person's mind will work. So as a sane person might think of all these things before they then go to take their lives, which might don't stop them from taking their lives. Somebody with mental health distress in that moment cannot see past that, and all they can see is the barrier that they've got in front of them, and the only way that they can see to removing that barrier is to take themselves out of the picture. Okay, so that's why in healthcare we would usually say suicide is multifactorial. So it's rarely a single cause. Okay, it can be a combination of depression, severe anxiety, trauma, other mental health illnesses. So in this case, we can say that there was autism can also be some of the deciding factors that could come to it. Life circumstances can cause somebody to want to take their own life. Things like bereavement, relationship breakdowns, financial difficulties is a huge one. So if you think about the Wall Street crash and a lot of people who end up throwing themselves out of high buildings because they've lost their livelihoods, employment problems and legal or professional difficulties, these can be life circumstances. So mental health circumstances we talked about, which can be depression, severe anxiety, trauma, other mental illnesses, these are life circumstances. You also have social factors, okay, so things like isolation, and in this case we know that Prof. Arday felt very isolated. He mentioned that in some of his notes. Discrimination, he felt discrimination against, bullying, harassment, loss of social support. So these is not a single social factor, there are quite a list of a few social factors. So that tied in with life circumstances and mental health, now the list is really building up, isn't it? So we can see that it's not just one decision of, I'm taking the easy way out. There's actually a list of things that can be going on in the background. And then the last things were individual factors, which can include previous suicidal thoughts or attempts. So if somebody has severe mental health anxiety and they've tried to do this in the past, it's very simple to go back to that place to say, actually, last time I tried to do this, I wasn't very successful, but this time I know what to do to make it successful. Substance abuse can be one of them, and then there's physical illness as well. So a lot of the time, people with physical disabilities or long-term chronic illnesses, debilitating ones, can often think about taking their lives as well. One important thing to learn from Professor Arday's death is that we cannot know everything that somebody's carrying. Okay, a person can appear successful, intelligent, funny, very sociable, faithful, and very professionally accomplished, and still be deeply distressed. We know that according to research, the facts show the people who commit the most suicides. Actually, I should ask this question and see if people can answer it. But if I were to ask the group, and I'll come back to this actually, just write it in the chat. So, who do you think is more likely to commit suicide? Okay, a doctor, a dentist, a bus driver, or a homeless person? If I had to put these 4 people, so a doctor, a dentist, bus driver, homeless person. If you can rate it in order of 4, just put it in the chat. Some people get involved in that, and then we'll come back to it. But who do you think is more likely to commit suicide? I'm going to write it in the chat so that you can just rate it. Just put 1, 2, 3, 4 next to it. So I'll put a doctor, dentist, bus driver, and then homeless person. And then just rate it from 1 to 4, what you think, who's more likely, and then we should get on. And if you're on the YouTube or you're on Facebook, again, you can just write your comments. We always circle back to YouTube or Facebook. So again, we'll go back to you there. Right. Okay. So essentially, yeah, there's some stats to that, but I'll come back to that in a minute. Okay. So yeah. It's very important to think just because we see somebody as well packaged doesn't mean that there's not things going on under. And we always use the image of a swan. A swan looks so beautiful, always floating on top of the rivers or the waters or the lakes or whatever there is that they float on top of, but their legs are always kicking very frantically under. And that's an imagery that we usually say to people who've got mental health. They may appear the most beautiful, the most calm, the most, like you would never think. And that's the mistake. It's the thing you will actually never think this person can do this. And then unfortunately, underneath it all, they're really struggling or battling with things. So sometimes it happens that way. So what does it look like? And this is where it's important. Obviously, as healthcare professionals, where we look out for some of these things, and we're tuned to almost look at the person beneath the rivers, and we see all the beauty, but sometimes we're able to pick up subtle differences. So this is what I'm going to teach you to be able to do today. Okay, so there are some things that you recognize when somebody starts doing. Sometimes these are what we call warning signs. Okay, so if somebody starts becoming withdrawn from friends and family, so they start taking themselves away. If somebody's very sociable and all of a sudden they start, and don't get me wrong, some people genuinely need some time alone, and that's okay. But there are several things you need to look at and just keep an eye on. So being withdrawn from family and friends is one thing. They stop doing things that they normally do and enjoy. So if somebody loves going to football every Saturday and all of a sudden they're no longer going, if you call them, they're not even picking up to tell you why they're not coming, and they just be like, oh yeah, I just don't feel like it. That's a red flag. If they start expressing hopelessness, so again, in one of Prof. Arday's, conversations with some of his friends, which has come out in the TV, he was saying that he just didn't see a way out, and that's an expression of hopelessness. If somebody starts using phrases like that, oh, I don't see a way out, or I don't see how this is going to end, this is going to end really badly, or I don't want to be around to see what happens, or when they start expressing things like that, it's almost a red flag as well. My fire alarm bells will start going off if I hear things like that. If they start to say, like, I feel like I'm a burden, this is a very important one for families. So if you have a spouse and your spouse starts using things like, oh, I feel like I'm a burden, you deserve so much better, I feel like your life will be better without me. If they start using terms like that, that's a red flag. Okay. If they start talking about death or not wanting to be here, so things like I just said, oh, I think you'll be better, your life will be better without me, or what if I just disappeared, what if I wasn't around, things like that, warning flags. When they start giving away possessions, so if they had like an heirloom which they really loved, a mother's ring, a father's ring, and all of a sudden one day they were like, dear wife, I'd like you to have this, I think take care of it when I'm not around, and they start saying things like almost being like, oh, when you're not around, where are you going, things like that. And sometimes we take it as a joke, but these can be subtle signs. When they suddenly put affairs in order. If you've got somebody who's very organized and they've got their will from when they were the age of 5 and, and everything is in order, that's not a red flag in particular. But if you've got somebody that you've been telling, oh, you need to get your will done, or you need to really, you really need to do this, you need to, and they've never really had a thought about it, or they've always kind of brushed it under the carpet, don't really care about that kind of stuff. And all of a sudden, then they then come to you and say, okay, I think I want to put my will together. For me, that's a bit of a warning sign. It could just be that they're turning around, or they've been to a talk that Dr. Akosua has, said it's very important to put a will together. But I would just ask a little bit more questions around that. Oh, why suddenly do you want to put your will together? I've been saying this for about 10 years now, and did something trigger this? Just figure out why they want it. It could just be that they've finally come around and they know that putting a will together is a good thing, or are they trying to put their affairs in order so that when they're not around, people that they love, they feel like don't have to suffer. So that's a big thing. And then if they experience major changes in sleep or behavior, so like I said again, if they start to be a bit more anxious, not able to sleep at night, or their behavior really changes, these are things to look at. Now, don't get me wrong, one sign does not mean that somebody is suicidal. Sometimes it's several of these signs. So like I said, they might become withdrawn, they might start expressing feelings of hopelessness, they might start putting their wills together and saying, okay, when I'm not here, look after my mom, things like that, look after the kids. So there might be 3 or 4 signs, and then this is where I'll start. If somebody just came home and everything else was fine and they've just done a will, I'm not going to suddenly be like, okay, you've done a will, I think you're going to kill yourself. That's not what I'm saying, but I'm saying you need to be a bit vigilant when you've got family members and loved ones, okay? Right. So in a situation like this, what do you do? If you notice that somebody has suddenly had about 3 or 4 of these things I've talked about, what should you say? What should you do? So the mainstay is, if you're worried about someone, don't dance around the subject. Usually it's a ticking time bomb. Now, again, statistics show that men are more likely to take their lives than women. Funny, because women are always known to be the emotional ones. Women are always seen to be the ones who, are easily affected by things. And a woman will cry about it, talk about it, and it's done. Men tend to keep things bottled up inside. A lot of the time, society makes men feel like they have to be the man, so men can't show their emotion, especially in our societies. In Ghana, there's a phrase that says "bemunsu," which literally translates to "a man doesn't cry." So even at a young age, like my toddler is 3 years old, but if he's crying, some aunties will be around, "Oh, minsu, bemunsu," or don't cry. A man doesn't cry, or a boy doesn't cry. And from the age of 3, essentially, we're teaching him that it's not okay to show his emotions. So some of these things make men really susceptible to committing suicide, because number one, they don't talk about it. The reason why women don't commit suicide a lot more than men is because we just talk about it. We talk to a tree, we talk to a cow, we talk to everybody about it. And sometimes just that act of talking about it releases that burden. If you keep things bottled inside, it gets bottled until the bottle goes poof. It's literally a ticking time bomb. So if you notice any of these things and you're concerned about it, what you need to say is, approach the person. I've noticed you don't see yourself lately. How are you really doing? Sometimes they might break down because they feel like, especially in the men's situation, a lot of men carry a lot. And sometimes as women, we don't really, perhaps we don't notice it, or sometimes we just think, oh, he's just being a man. But sometimes they really just need somebody to ask them. And then they feel like somebody actually cares. You might notice it and think, I'm not going to ask him because it's going to make him embarrassed or whatever it is. And again, I'm being very gender biased at the moment because I'm saying, but doesn't mean that doesn't happen to women as well. So definitely, please watch out for both sexes. I'm just going to what the statistics say. Men are more likely. Doesn't mean it doesn't happen to men. So I'm just going to change my phrases and say, if you notice a loved one, a spouse, whatever gender they are, just go to them. I've noticed you don't see yourself lately. How are you really doing? They might break down and tell you. They might not tell you. Okay, just because you've asked the question doesn't mean you're going to get an answer. Okay, if you're really concerned, then you ask the question straightforward. If you're really concerned, say, are you thinking about suicide or hurting yourself? Especially if somebody has expressed hopelessness or starts saying things like, oh, I feel like you'll be better without me. I feel like your life would be much better without me. I think I should just disappear. I would just be like, yo, Kweku, are you okay? Is everything okay? I'll pause for an answer. If nothing happens, I will say, are you thinking about suicide or hurting yourself? And I would ask that question directly, just as a don't mince it. It's a ticking time bomb. We don't want to be playing around with it. Okay. Asking you does not put the idea into somebody's head. If somebody's going to commit suicide or thinking about it, they're already thinking about it. You're not going to put the idea into their head. If you mention it and the person's not thought about it and does think about it, chances are they're not going to commit suicide because it's not their thought. Okay, so you can never put the idea of suicide into somebody's head who's not already thinking it. So don't think you're not going to ask it. And that's why when you come into the hospital and we think you've got mental health, we will ask you. A doctor will ask you, have you ever thought about committing suicide, or have you actually attempted to commit suicide or hurt yourself? We don't put the idea into your head. If you've got the idea, you've already got it. I'd rather know that you've got the idea than not know because I'm scared of asking. And that's what I want to put in your minds today. Okay, you can't put the idea into somebody's head. If it's there, it's already there. Okay, and it's important that we find out if it's there because we can do something about it. All right. So how the conversation needs to go, you need to ask, are you thinking about suicide? Then you need to stop and listen. Don't immediately try to solve everything. Ask the question, pause for at least 5 to 10 seconds. Look at their body language, look at what they're doing. It can tell you a lot. If they say something, or if their body language tells you something and you're still concerned, take it seriously. Nothing wrong with going and, saying to your GP, I think my husband or my wife is thinking about suicide. If they're not thinking about it, it's okay. But if they are thinking about it, you could have saved their life. Okay, take it seriously. Connect with them, help them access a professional or emergency support. If you really think it's really urgent, call 111. Somebody can advise you. If you've walked into somebody trying to take their lives, 999, or take them straight to emergency services. Okay, like I say, it's a ticking time bomb. We need to take it seriously. You don't need to be a psychiatrist to support somebody through suicidal thoughts. It helps, but you don't need to be. Okay. What's happening here? Sorry, my computer's just frozen. Can you still hear me, guys? Okay.
Yes, ma'am.
All right, thank you. So sometimes the most important thing you can do is just simply stay with them and help them get through the night. Sometimes it's just a night, and in my profession, I've had so many people can have a fleeting thought just for one night because something bad has happened to them. They've lost a grandmother who raised them, they've lost a job. And for that night, they're thinking of suicide. But just by being there with them and talking to them and stopping them from doing it, and then that's it. But if nobody is there and they're isolated and they feel and they think, and the thing is, the more you feel isolated, the more the thoughts come and the more the voices tell you, do it. And it might just be an impulsive thought, but that one night could change everything. So like I say, if you're concerned about somebody, just get advice as quick as you can and treat it very seriously. What you do not say is think about your children. It's almost insulting, really. If somebody's thinking about taking their life and you're telling them, think about your children, other people have it worse, do you really think that person's not thought about that? If a person has young children, they've probably thought about their children 1,000 times, but the thought in their head is still, my children's lives would be much better without me because I'm an embarrassment to them or because I am a failure. So they've thought about it. They have thought about their children, and that's why they're thinking of committing suicide. A lot of in my experience, African families will go straight to, well, you need to think about what's important. Think about your children. Think about your mother. Think about your wife. I've thought about them and I think their life will be better without me. That's why I'm thinking of committing suicide. And that's the honest truth. So that's not something you should be saying. Okay. Or things like other people have it worse. We know that other people are stronger than me. That's why I'm thinking of a way out. You need to pray a bit harder. I'm not even going to get into that one because I've talked about religion on this program several times. Prayer is good, but when somebody's thinking about suicide, trust me, at that point they're not thinking about prayer, or they're probably thinking they're as far away from God as they potentially can be. They're not thinking that God is hearing their prayers, and that's why they're thinking about suicide. Okay. Some people say things like, stop being negative. You're being selfish. Oftentimes, when people think about taking their lives, they're actually thinking about doing the most selfless thing on earth. Like I say, they look at their situation. They're not taking their lives for themselves. They're taking their lives because they genuinely believe that if they're not around, their parents' lives will be better, their children's lives will be better, their spouses' lives will be better. They genuinely are not doing it for themselves. They're doing it for other people. It's the worst thing you can say to somebody who's trying to thinking about taking themselves out of the picture, that you're being a selfish person. Trust me, they're not. They're not being at all. Okay. And then the very annoying one that a lot of people have said to me is, you have everything to live for. Well, according to who? You might think that having a big house, having a car, being married is everything to live for. That person clearly doesn't share that perspective. For them, everything to live for is not being an embarrassment to their family. It's not being isolated. It's having friends. It's having people they can talk to. It's having a job. It's not being bankrupt. So that's, for them, that's what they want to live for. You might think otherwise, but everybody's perspective is different. So please, please, please do not compare your life to somebody and tell them how to live their lives. What you need to do is ask the question, listen to what they have to say, get help if you think they need help, connect them to the service that they need to. This is the only 4 things you have to do. Don't be judgmental. Don't give advice. It's not your place. Okay? So instead of some of the negative things you can say, it's better you say something like, I'm glad you told me. Let me help you. You don't have to deal with this alone. We're in this together. I can help you. Let's get some help. Let's find service that essentially the person just wants to know that they're not alone, they're supported. Yes, you might think they're silly, you might think that you might not share their ideas, but that's not the time to tell them. You don't kick a man when they're down. And in fact, I don't think you should ever tell them that you think they're silly, but I think you just need to be there and support them through it all. Okay. So one thing I just wanted to really touch about was faith and suicide. So as for when I say faith, I mean things like religion. Okay, so Christian, Muslim, Jew, Hindu, whatever you believe in, faith can be a source of hope. It can be a source of community. It gives people meaning to life. It gives people support and belonging. But faith should complement healthcare. It shouldn't replace it. Let me repeat this. Faith should complement healthcare. It should not replace it. Now, the reason I say this is because, again, I've said this several times on this show, for many African families, faith is incredibly important, and there's nothing wrong with that. Okay. Prayer can be enormously comforting, especially if a person truly believes in prayer and a person believes God can do it. Okay. Prayer is very, very comforting. You can offer somebody prayer, but telling somebody who's suicidal simply to pray harder is not a solution. It can make them feel more distressed. It can make them feel like a spiritual failure, because if they've not been praying, will they have arrived there? No, somebody can say, well, I've been praying for 5 years for my financial situation to get better. I've been praying for 10 years to have children. I haven't had a child. They feel like a failure. So just telling them to pray harder is not a solution. And actually, it makes them feel worse. Okay. So mental health is not a lack of faith. Depression is not a lack of faith. Feeling sad is not a lack of faith. Seeking medical or psychological help is not a lack of faith either. It's complementary to faith. So you give what you have to give to Caesar. You give what you have to give to God. If you think about it, you do the prayer part, you do the healthcare part. They work hand in hand. Okay. I'm not saying one is better than the other, but you got to do both. Okay. If somebody's suicidal, somebody's got mental health, they have to see a healthcare professional. Okay. God gave healthcare professionals the ability to treat mental health conditions. It comes from God. So it's hand in hand. God gave us the tools to be able to do it. So you pray for us as healthcare professionals to be able to heal and to be able to provide support. That's what you do. Okay. You don't say, just pray about it. Forget the doctors, forget the healthcare professionals. That's the worst thing to do. Okay. Now, one last point before I get to questions and answers. Stigma. Huge in African and Caribbean communities. Okay. Sometimes mental health is described as attention seeking. Weakness. It's a spiritual attack. It's being ungrateful. Look at all that you have. You're being ungrateful. It's a lack of faith. So, it's something we don't discuss. In Ghana, we say, we don't talk about it. That's what it means. We don't talk about it. But silence doesn't protect people. In fact, silence can isolate people. If somebody feels like they're going to come and be open to you and you're going to see them as being weak or being attention seeking, guess what? They're not going to come and tell you, even if you ask. If you ask what's wrong and they genuinely believe that you believe that mental health is a weakness or is a spiritual attack, they won't tell you. Okay. And this can isolate them even further. So we need to create communities where someone can say, I'm not okay. We need to stop telling men not to cry and say men can cry. We need to tell them men can cry without being embarrassed, okay? Or being immediately judged. We need to say you can have a mental health problem without being embarrassed, being judged. And as you can see, I've got safe spaces in my back. I'm going to keep talking about this, but safe spaces is the mental health community interest that I've created to help facilitate mental health conversations within the African Caribbean communities. This is what we do. We provide a safe space. So if you're here on this program and you feel like you don't have a space where you can go and say, I'm not okay. You don't have a space where you can go and cry on somebody's shoulders. You don't have a space where you can go and say, actually, I just need to let it all out. This is what we're here for. And you can contact us at any time. Okay. Right. Back to my question. So I asked about the dentist, the doctor. Let me see. Have I got anything in the chats? Or if we've got somebody, oh, here we go. So we've got any of them. Oh, I like that. I like that. So you said any of them can there is no ranking. I like that. And I'll come to that in a minute. But there is a ranking. There's a little bit. And I'll come to that in a minute. So he says homelessness, because that man is down. He that is down may fear no fall. I like that. I like the thought process behind that. Okay. Oh, so EQ has said bus driver first, dentist, doctor, and then the homeless person. You've got the homeless person right to put that at number 4. Okay. But apparently farmers are highly ranked to commit. So yeah, farmers as well. Yeah. And then Aisha has put doctor, bus driver, homeless person, and dentist. Person least likely. And you know what? I wish we had more time so that I could ask individual person what are your thought process and why you put that in that order. But I can see where the trend is coming from. Okay. And I think we'll do another session maybe to get you guys to tell me why you think that. Statistics will show that dentists are number 1. And actually, so it will be between dentists, and within doctors, it will be an anesthetist, so anesthetic doctors. So dentists and anesthetic doctors almost probably are the same, or they share a common sort of high risk. Then it'll probably, the next will be a bus driver. It's a highly stressful job. Okay. It can have a lot of health implications. Lots of bus drivers will end up with back pain, some type of osteoarthritis and things like that. Before a homeless person. Now, somebody said homelessness because it's when a man who is down may fear no fall. But that's exactly correct. If you're already at your lowest, you can't go any low. So a homeless person who lives under a bridge is not going to think, well, what's this person going to think of me? I can't provide for my family. I'm just going to take my life. They're going to be like, no, I'm just going to live under this bridge. I'm cool. I get bread a day. I'm fine. They, I'm not saying they don't commit suicide. And don't get me wrong. They do. But some people do. But it's just, they don't really fear. There's no fear of losing anything else. The reason why anesthetists and dentists are the jobs are highly stressful, but they're also highly successful. The highly successful individuals who don't do very well at failing. So if a dentist or an anesthetist feels like they've become a failure, it's a very, very small trigger to pushing that button. Now, the reason they say within all doctors, anesthetists are the ones who are more likely to take their lives because they've got access to the drugs. So an anesthetist basically kills you when they put you on the operating table and then they revive you. They're practically like close to God in the doctor profession, because they kill you and they bring you back. They've got the drugs that can literally kill a person within an instant. And so do dentists, because dentists also use anesthetic drugs when they do the teeth and things like that. And that's why they have the highest rate of committing suicide. They know how to do it. It's easy for them, but it's a very thin line between I'm successful and I'm not. Doctors are very high achieving people, and things that you might say are not failures. A doctor may go to work and may have had one bad day because one of their patients has passed away or they've made a wrong diagnosis. That can be a trigger for them to kill themselves, because they feel like, okay, they're going to get GMC registered. GMC, or the General Medical Council, is going to investigate them. They're going to lose their job. How are they going to care for their kids? How are they going to care for all these thoughts come rushing in, and then they think, oh, look at that. That's a bit of anesthetics there. Let's just do it. Let's just do the job. And then they're gone. That's how it works. Okay. So the people that we feel are least likely to take their lives are actually the beautiful swans swimming on the river or the sea. They're actually the most likely people to take their lives. And that's what I'm saying. Suicide is not something you can look at somebody and instantly say, oh, they're going to commit suicide. So you need to look at some of these red flags we're talking about, some of these signs and symptoms. And this brings me to my next slide when I talk about men. I've already talked about that already, but men are less likely to seek help. They're more vulnerable because they feel like they need to be men. They keep everything bottled inside them. So we need to, if we've got male friends in our lives, male people, our partners, our brothers and sisters, as soon as you have to have a very low threshold for a man. If a man starts acting in a way that you're suspicious of, ask the question. If they're not being forefront with you, seek help on their behalf. Literally, I would call my GP and say, I'm worried about my husband. Can you please have a review with them? Or call 111, ask for advice. What can I do? I'm worried about this person. Okay. Get some paramedics to come home and assess them if you need to, but have a very, very low threshold for men. Very low threshold. Okay. Right. I'm going to skip a few of these slides, but we've talked about professionals and, professors, highly educated people. These are very particular. So high achieving individuals are more likely to commit suicide than low achieving, or what we call low achieving individuals. Like I said, a man who's already down is not going to think, if I take my life, I'll take everything away, because everything's already been taken away. But a high achieving individual, in this case, Professor Jason Arday, he was, a young professor, made history. He was literally, going to achieve so many things in his life, but all of a sudden one day that's all taken away from him. He's lost his job. He feels like he's lost his dignity. He's got nothing else to live for, and that's how he feels. And that's obviously, this is some of the thoughts that go through people's head when they're taking their lives, and that's how it happens. So he's, in our heads, whether he's most unlikely to do it, but actually in medical terms, he's the most high risk person that we would be looking at. Actually, he will do it. Last couple of things to mention: social media, public scrutiny, and mental health do not go hand in hand. In the case of Prof, again, the weeks before all of this happened, social media bashing, public scrutiny, all of these things. And again, obviously his is on a much high level occurrence. But if you think about even on the local level, like I said, with high achieving individuals, if somebody loses their job, it might be published in the local newspaper. They might feel like, people at church might find out, people at the mosque, or people on the street, I might lose the house, all that stuff. And then there's social media bashing, which we're not even going to get into that. But again, if you think about, a lot of teenagers have been committing suicide recently because they're getting bullied over social media, getting harassed over social media. So if you have children in particular, you need to be very careful in terms of how they're accessing social media, especially teenagers, because teenagers feel like they don't need their parents' consent for anything, but that's where all the trouble comes from. Okay. And I think I'm just going to end with, what can we learn from what we've talked about today, and what can we learn from Prof. Arday, and how could we have prevented it, okay, if he was our family member or our friend. So we need to check on people, not just, are you all right? Actually ask them, how are you really doing? If you're worried about something and you say you're right, and they say, oh yeah, I'm fine, it's all right, and you're genuinely concerned about them, say, no, actually, how are you really doing? Ask the question. Remember, ask. Secondly, don't assume success means being well. Take changes in behavior very seriously. Reduce the stigma around mental health so people can approach you. And again, you can talk about people. You need to ask and then listen. Remember, not judge, but listen. Be careful with public criticism and online behavior, especially if somebody has done something and they keep checking online, or this person saying this. Just take the phone, hide it, say you need to be phone free for at least about a week. Because the more you see it, the more your brain's going to tell you, So yeah, social media is not really helping with mental health these days. And if somebody tells you that they're suicidal, please do not leave them alone. Listen to them, stay calm, take it seriously, encourage professional help. And then in an emergency, call 111, call 999, take the person to hospital. Do not shame them, do not argue with them, do not promise secrecy, because if somebody tells you, I'm going to commit suicide, and you say, don't tell anybody, don't promise them, say, if your life really is at danger, unfortunately, I'm going to have to tell somebody. Yes, it might stop them from talking to you, but that's okay. They don't need to talk to you. You just need to get them to healthcare where we can assess them, okay? But if you promise them secrecy and then you don't deliver that, then again, in the future, they can't come back to you, or they might feel a bit betrayed by you, okay? And then my very, very last point, sorry, I know I'm going on, but this is a very, very important topic. If you're struggling with any of these things I've talked about today, you don't need to wait until the breaking point. You need to speak to your GP, a mental health professional, someone you trust, a mum, a sister, a best friend, a crisis service. In the UK, Samaritans The Saranton number is online, but it's also 116123, I believe, 116123. It's free day or night. Call Samaritans, they can help. 111 for NHS, free as well. If somebody is in immediate danger, please seek medical help. If you are in immediate danger, please seek medical help. And then for our tribute to Professor Jason today, let us remember that he was a person, not just a tragedy. Let us remember his story. His story was very difficult. It was, it comes with, it was just a lot of race, neurodiversity, achievement, mental health. It had a lot of public scrutiny. There was a lot of compassion in it, but we need to remember that he was a person. He had a family. We need to respect the family's wishes, and we just need to be a bit mindful when we talk about suicide, how we talk about people's lives and how it can affect them. I'm going to stop here, and I'm going to take any questions that you have on suicide, mental health, or anything medical. Like I've said in the past, if there's anything you want to ask about, feel free. Thank you.
Maybe I'm discovered for Europe. I come for Ghana. No, me used to tap send. No fee mobile money transfer. Easy, convenient, fast, and sounds so free. Won't you share? Me discover map tap send. Also download the Taptap Send app. No, mobile phone so free. Na first ka come abusuya for Ghana for na nyina. Taptap Send. Papa no.
Hello and welcome back to the OT Health Talk every Wednesday, 8 o'clock. Thank you all for being here on time. We've just a brief sort of summary of what we've talked about. We've talked about suicide today, how to spot the changes, and how to seek help. And then we've paid a tribute to Professor Arday, who has been in the news recently for taking his own life after a very difficult moment in his life. So I can see some of the comments on the side, and people are still quite shocked about what we talked about earlier in terms of dentists. And yes, you're quite right. It's because they have drugs, so it's easier to do. So if you have access to means of, a lot of people who've attempted suicide and have been unsuccessful at it will attempt again at some point, or may try to attempt again, and eventually some people attempt a few times and eventually are successful. Most people who don't have access to drugs and things will attempt several times before they're eventually successful. Unfortunately, doctors and dentists don't have to attempt. They've got the means to do it, and if they think about suicide, they just do it, and that's why the numbers are so high with them. So maybe if they didn't have access to it, it would be like everybody else. They'd have to attempt several times before they finally find a way, but unfortunately they do have access to the drugs, and it's much easier for them. So that's why doctors and dentists are much susceptible to committing suicide. Right, I've got a hand up. Is that Amma? I don't know if it's our resident Amma or somebody else. Is it Auntie Amma, please?
It's me,
hello.
Mama. Hello.
We've missed you.
Thank you. Yeah, I've also missed you. Yeah.
Thank you.
Very sensitive. Thank you, Dr. Coles, and hello, everyone. Very sensitive topic. I've been, should I say sad? Because it's a top. Suicide is something which, and depression in men has been something on my mind. And even when I was practicing as a midwife, I saw the need for men to be inclusive. So I did I encourage men to come with their wives during parent education. And one of the things I actually picked up from men, and it keeps on happening. So anytime I hear a man is being depressed or a man has committed suicide, it really affects me. No, I shouldn't say. Yeah, it does affect me, and I'll just be asking myself so many questions. How can we reach out to this man? And again, I mean, you were spot on when you said, we have made them to be what they are from a child. Don't cry. We a Burma. Men don't cry. Who told you men shouldn't cry? When I see a man crying, I'll say, well done. So, I don't know. I've been thinking, and when I just saw the topic today, I was like, thank God. At least someone has picked it up, And in times like this, when people are asking so many questions, I don't know. I actually called you. I wanted to just discuss this issue. How can we? There should be a setup for our African men to talk. The silence is just too much. They don't talk. And when you look at the statistics of men being ill or dying, even from diseases, it's really high, especially in cancers. Prostate cancer shouldn't kill a man now.
And I think we've talked about this previously, haven't we? I think when we did the cancer session, and we talked about how I think, unfortunately, like you correctly have said, not only being a man, but number one, being a man already puts you at risk, because men tend to not really express themselves or they feel like them. But then being a black man puts you at even higher risk, because we know statistically non-black men are more likely to share and or to seek help, at least even if it gets bad. I've done a lot of prostate exams on non-black men. I'm yet to do a prostate exam on a black man.
You won't get one.
So
I'm just being honest.
So you raise a very good and important point.
Yeah. It does. Daily I sit down and then I'm trying to look for solution, but it's like when I just decide, okay, this will, and then it doesn't work, and then I think it does depress me a bit. But I think we need to come up with something. We need to come up with something so that we can help our men. I think I've said this on this platform. When I had my treatment, and then we had like a session, and then everyone would sit down. That was how I was able to come out as a black woman to really talk about cancer, to talk about how my journey through cancer. It was something I had to learn from there, because no African person will tell you, or Caribbean person will tell you I've got cancer. They hide it. And especially the women will talk, but the men will not even say a word. Yeah. So by the time they find out, I've had men who have had, they knew that they were not,
feeling well.
Yeah. Feeling well. They kept it to themselves. By the time they got to the hospital, from A&E to ICU, and then death.
Yeah.
And it is a shame. So I don't know. I think as a community, we need to come together and then come up with, I know safe space is there, but again, the stigma, please, let's try and help each other. When you see a man crying, don't say, how do you call it? Or your mama ba, I know, or your ba. Those things.
Auntie, have you seen the comment in the chat? I think there's one for you.
Oh,
thank you so much for bringing that up. And I think you raise a good point. We need to talk about this more, definitely, especially as a community, African Caribbean community. We definitely need to talk about it more. But have you realized another thing, that even on this platform, there are many men who come on this platform, but a lot of the time, even when it comes to the conversational bits and making comments and asking questions, there's always the females who do it. And we've even had specific times where we've done sessions just for men. So we've done men's health, we've done prostate cancer, prostate health. And even then, the women were the one asking the questions. So I want to ask the men on the program today, is there something that we can do? And I know we've asked this previously, but I'm always going to keep asking until we get it right. Exactly. You know, what can we do to get you guys to engage? Because I could set up a charity. I could set up a charity for men's health, and particularly Black men. And I have a feeling I would be the only one who would turn up whenever we have a meeting, because I just feel like Black men don't engage. And why is that? Can you help us answer that question? I think the person who answers that question will become a millionaire, but can you help us answer that question?
Dr. Kos, again, I will use my personal therapy, you know. Let me just be honest with you. Wherever we are, we should be, whether you are a man or woman, we should encourage our men. In my local church, I had the opportunity to do a health talk, and then that's really opened up this thing. You know, I was just not biased. It was just the men. I spoke to the men as a woman, you know, and that was when they started coming out. You won't believe it. Men will call me aside and say things that I would just say, wow. You know, let's not be biased. Let's allow the men to be the men and encourage them to, you know, look after their health. You know, when they call for meetings, it will be just a few men who will attend. But now, what I've actually noticed is that men have started coming. I mean, they had a health talk with Dr. Elijah about 3 weeks ago. I said to myself, I was there. I wasn't in the auditorium. I was actually sitting in my car because I didn't want to go there so that the men will feel bad to ask the questions that they need to. But the turn up was excellent because I was so happy. At least the men are looking after their health. I actually told them every year, go and do a blood test to check everything. And I've got men who will come to me I think this is about 3 years, and they'll come to me to say, oh, thank you, I've had my check, this is the result.
So Auntie, I think what we need to do is we need to maybe get you to come and help promote it to our men. But I'm just going to stop you there. Thank you so much for as always, getting involved and honestly making the conversation, you know, bringing the controversial point, but making it very important and, you know, making very important points that our men need to hear. So thank you so much, Auntie Amma. I'm just going to take a question in the chat, which says, what warning signs should parents and mentors watch out for in teenagers and young adults? And I thank you that you brought that up because I ran out of time. I didn't want to delve into that too much, but since you've asked the question, I can go into it. And then I think if there's a follow-up question which says, what helps young people feel safe enough to speak up? So I'll answer the second question first. So what helps young people feel safe enough to speak up? Now, every young person is different. From my experiences, obviously, we know that Safe Space is a charity for young people. It's different for everybody. So everybody's trauma is different. Some people need no prompting. You just need to ask them, what's the matter? And they'll go on and on and on and tell you everything. For some people, you can ask, or you can go on and on and on. How are you? Are you okay? Are you sure you're okay? Are you sure? And no matter, you know, how good or what rapport you've built with them, some things are just difficult for them. They just can't say it. So every young person is different. If I'm going to generalize it, I think everybody, and not just young people, they want to feel safe. They want a safe space. So they want a space where there's no stigma, where they don't feel judged, where they don't feel like where they feel like they're heard, and where they feel like they can genuinely get help. So a lot of the time, again, when I set up safe spaces, what the young people were saying to me is, I don't talk to my parents. And Black young people said, I don't talk to my parents because when I talk to them, they tell me I'm trying to seek attention or that I'm being possessed. We need to go to church to pray about it. And I just feel like they're not listening to me. All they need is to understand that their voice is being heard. But that's not just young people, that's everybody. And this is what I talked about even with spouses. So I'm going to, again, be a bit gender here, just say more male, but even females as well. Anybody who's going through mental health or any sort of difficulty wants somebody who truly listens, and listens not to judge, not to comment or give advice. Sometimes you just want somebody to listen and know that they're there listening. And that's why, if you've heard, consultations with ChatGPT have gone up. Because when you go to your GP, you've only got 10 minutes, but ChatGPT got the whole day for you. People are putting their problems into ChatGPT. They're telling ChatGPT their mental health problems, and they're getting advice from a robot because it's unlimited. So yeah, that's the answer to the second question. I will answer the second question. What warning signs should parents and mentors watch out for teenagers and young adults? Very similar
Dr.
to what
Akos, can I help you with that question? Because I've got teenagers who have actually.
Please, very
and then
briefly, and then I'll jump in as well.
I'll be very brief. But this thing happened in Ghana just a couple of months ago. And this is a young man who went to a university, is it JSS or how do you call it? Secondary school, let me just put it because...
Oh, yeah. Okay.
Yeah. And then the parents noticed when he came home, he won't go out of his room. You ask him for food, he had lost weight. And apparently, when he went to the secondary school, a group of friends called him and said, "Oh, let's go out." And then he said, "No, I can't go." The parents were Christians, very well to do. But this boy, they forced him, and then he went out with them. And apparently, they dragged him. And I think it was 3 boys. They had sexual, intercourse with this boy.
I heard this.
You heard about it. And this boy came home, the mother tried everything. He actually opened up to the father. I don't know if you followed the story. Open up to the father. So when you notice that your children are not engaging, the first step you have to do is you need to reach out to them. Something is going on. I've got a boy and a girl, 19 and 21. But it's been, as soon as I noticed that they are very shying away from, I just call them, "Hey, and please, let's be friends with them." When we were growing up, you can't even slap you tap your father's hair. My children do that to me. They will come and tickle me. There shouldn't be a hierarchy in the house. Let them feel that they are also part of the family. Let them come out, ask them questions. When you are going out, you're going to even buy a car or anything. Can you choose the car for me, which you like? And sometimes when they choose it for you, you don't have a choice. You have to go with it. I have done it so many times. I want something, and they would let them feel they are part of a family, a community where their voice can be heard. They will come home and tell you everything. And my son will come home. Yeah. So please, let's involve them. Thank you.
You've hit the nail on its head, and I think I'm not going to say, because that's exactly what I was going to say, and I think we've had this conversation on this platform before when I've said it's very important that as a parent that you're friends with your children. Now, don't get me wrong, I understand how culturally, that sounds, and I love this new parenting thing where, children can genuinely speak freely to their parents, not in a disrespectful way, but you can be respectful, but also you can be assertive. There's a difference, right? And I think we should never try to put down our children when they're being assertive. We can correct them if they're being rude, and correction is fine. But I think it's important to you can be friends with your children, but at the same time you can be a parent. Okay, there can be a line drawn there. But like Auntie Amma said, your children should be able to find you approachable. And that's the first step to it. And she said everything, so I'm not going to repeat it. But much similar, in the same way that I said before, when I said about even in anybody who's in your life, not just children, but how do you tell the warning signs? You need to be vigilant. I've said this several times when it comes to parents. You need to be vigilant. I know, again, culturally, speaking from an African Caribbean, I know parents can be busy. Some parents are single parents. They're working 3 or 4 jobs just to keep the boat floating. I understand that. I'm not bashing that. I think you're brave for that. I think you're incredibly amazing for doing what you have to do. But keeping the boat afloat and being vigilant on your children can be incredibly difficult. But this is where it's important. The story Auntie Amma spoke about, when the mum tried and she wasn't, she didn't get anything out of the child despite trying several times. Eventually, the father got it out of the child. What we can learn from that story is, if you think there's something definitely wrong with your child, your spouse, your friend, despite prompting and trying to ask, nothing is happening, you can seek external help. Perhaps the mother had gone to the father and said, "I think something's wrong. I'm not getting through to him. Why don't you try?" And maybe the dad tried. You can do the same thing. If you're a single parent, you can just say, "Okay, maybe I'm trying." Get somebody else to try. The pastor, the youth leader, your son's or your daughter's godfather or godmother, somebody is close enough to the child. But the struggle in that is that sometimes when it comes to children as well, we know that sometimes the abusers can be from home. So in this way, God forbid, but if your son was being molested by their godfather, let's say for example, and you then went to the godfather and tried to get the godfather to get it, I mean, that can be a bit counterintuitive. So this is why being vigilant is important. Think about it. When you mention the person's name, or when you mention, okay, we're going to Uncle Kwesi's house, how does your child respond? Do they respond with excitement? Do they respond with withdrawal? No, I don't want to go. What's the, you can pick up on subtle signs. So these are what you need to watch. You just need to be vigilant with people, especially your children. You really need to know your children. And as soon as something changes on your child, now don't get me wrong, when I was younger, my favorite food was like banku, and then it changed to kinky, and then it changed back to banku. And to be honest, I've been bouncing back between the two. So my mom always says to me, I don't know what your favorite food is, because this week is banku, tomorrow it's kinky, right? That's not what I'm talking about. Yes, it's, children change all the time, but there's subtle changes. Like, is your child an outgoing person? Suddenly, they don't even want to step out of their bedroom. That's something worth investigating. Okay. Does your child sleep in the dark, and all of a sudden they're turning the light on? They can't sleep in the dark anymore. And I don't mean this is after watching Exorcist for just a week and then they're back to being normal again. They can't sleep with the light. What's scaring them? What's changed? We need to pick out these subtle differences. Right. I'm just going to read the last comment in the chats because I'm mindful of the time. And we're supposed to finish at 9. So I'll just read the comment and then I'll round up. Okay. So Nancy saying we weren't raised to share our worries publicly. And because of what we've been through, we make it hard for our children to open up when they have issues. And I think that's correct. But that's what I was talking about. I'm loving this new style of parenting where I'm not, it's not children being disrespectful. It's children being able to be open to their parents. I'm not saying your child should be able to come to you and slap you, or should be able to walk off and be like, shut up, mum. No, that's not what I'm talking about. I'm talking about your child being able to come to you and say, Mum, today I had a really bad day at school. Is it okay if I don't wash the dishes? And you should be able to say, that's okay. You can go upstairs and rest if you've had a bad day. You shouldn't, these are the type of things we should be human to our children. We shouldn't be robots. Yes, you can discipline a child, you can train a child, but, you can also be a bit caring. Because if your child has told you they've had a tough day and they'd like to put their feet up, and you're very specific, no, but you've got chores to do, you have to go and do it, I think that's not really being human. Because if you've had a tough day at work and you asked your boss, I've had a tough day today, can I have a half day? And your boss was like, no. Or, then you would say that's a toxic working environment. So why are you making the home a toxic environment for your kids? Let's think about that. I'll end on that. Let's see, did I have another? Okay. So if you guys want us to talk more about this, just let us know. We can put that in the chat. But like I say, thank you all for coming. If there's anything you've forgotten today, just please remember that if you spot subtle changes in people, take it seriously, ask the question, listen to the answer, and ask for help if you need. Okay. Like I said, there's Samaritans, there's NHS, there's A&E, there's 111, and there are people like me. Okay. So if ever in doubt, I'm always on the OT media platform. Please feel free to reach out to me. I'm more than happy to advise. I've got my social media platform. I'll put things all up. So, but yeah, please do get in touch. And I hope we see you next week, Wednesday, for our final sort of August session before we change to our new schedule, which I will explain all next week. Next week, we've got a lady who works, who does hypnotherapy and meditation. She's going to come and tell us how to do, she's a Christian. She does it's not like, when you say hypnotherapy, people start thinking of occults and things. No, she does this almost mindfulness. And she's going to come and show us how to take some time out of our day, how to, stress release, and how to, and again, it's all related to mental health. So please do come next Wednesday, same link, same time, 8:00. Hope to finish at 9. Remember, every Thursday we have a time with Taptap Send, and every Friday we have Ask the Lawyer. So we've got loads of things going on for you. But once again, from the OT Media Health team, thank you so much for coming, being here on time, and staying all the way through. Hope to see you next week. Have a lovely day. I'm going to put the links in the chat in just about 5 minutes, so you can hang around if you need any of our contact details. But thank you so much. See you next week. Bye bye.
Thank you, Dr. Akos.
Make your mark.
Thank you, Auntie Amma. Always lovely to see you.
Lovely to see you too. Where is Lady Abna?
She's taking a sabbatical. But she will be back.
Okay. We'll talk later.
Sure. Sure thing. I'm putting the link in the group now, so if anybody needs it.
Auntie Emma, where have you been?
Is that Auntie Liz? I didn't even see you. Hello, Auntie Liz. Oh,
hello, Doctor.
On the way back.
Auntie Emma, you've been hiding from us.
I've been busy.
You're always busy.
Even in a few weeks I will be traveling, so when I come back.
So when the British Airways will connection here, trying to take it to the family.
Me too, end of.
Sebastián, ven. Dile.
There is no academic contribution this man ever made that explains his star quality in inverted commas. And you said he's a star, but he's not a star in any conventional sense. He's a star because of his story, and that is it. It is notable that this guy didn't call the police when there was allegedly a masked man.
Me did young antechwa and maybe I'm discovered for Europe akuma busia for Ghana no. Me used to tap send. No fee mobile money transfer. Easy, convenient, fast. And sounds so free. Won't you share? Me discover ye mapim. Tap Send. Intienne. Also download the Taptap Send app no. Ewa mobile phone so free. Nefesi kakomwe busia for Ghana for na. Taptap Send. Papa no.
Hey, shalom, people of God. My name is MOG Music, and I have great news for you. Guess what? Taptap Send is partnering with MOG Music for Back to the Basics, happening live at the Oval Arena on the 22nd of August 2026. This is great news. If you're watching me right now, I need you to go to brushfire.com/MOG Music. That is brushfire.com/MOG Music and get your tickets. The promo code to use is Taptap Send. The promo code to use is Taptap Send, and you're going to get a massive. This is the greatest discount Taptap has ever brought to Back to the Basics at the Oval Arena. So I want you to take advantage of it. We just have 200 tickets only. 200 tickets only. And I need you to take advantage of it and get your ticket today. If you don't have your Taptap app, download it today and start sending money to your family and friends in Ghana, in Nigeria, or wherever in Africa. I urge you to continue to use the app. It's a great app. I want to say a very big thank you to Taptap for this amazing support that you have given to the Back to the Basics with MOG Music at the Oval Arena. I can't wait to worship with you. Taptap Send is sponsoring Back to the Basics. Thank you very much, Taptap. God bless you. I'll see you all at the Oval Arena on the 22nd of August 2026. Stay safe.